dealing with vaginal dryness and difficulty in intercourse. This is a very natural thing which happens in perimenopausal or menopausal women. It is natural for the female to start losing interest in sexual activity as she ages, which happens in most of the families. Because the male partner wants to have that physical this thing, and the female will not be able to please the male. What happens here is there is reduction in the estrogen hormone, and estrogen reduction happens as a natural phenomenon of menopause. And because of the reduction in the estrogens, the lining of the vagina, which was supple and more fleshy, will start becoming dry and it starts shrinking. Because of the loss of hormone estrogen, because of reduced quality of the membrane, that is the covering of the vagina, it becomes dry. That is a stage called hormonal deficiency, which gives rise to senile vaginitis. This is called as senile vaginitis. Because of the reduction in the hormone estrogen, the immunity of the vagina also reduces. And because of lack of that lubrication, that is the lubrication is nothing but the vaginal secretion which happens naturally in any intercourse, will be reduced. And because of the reduction in the lubrication, there is dryness of the vagina. Hello, I am Dr. Chandrika HS, dealing with vaginal dryness and difficulty in intercourse. This is a very natural thing which happens in perimenopausal or menopausal women. It is natural for the female to start losing interest in sexual activity as she ages, and this will not happen with the male partner. That is the problem which happens in most of the families. Because the male partner wants to have that physical this thing, and the female will not be able to please the male. What happens here is there is reduction in the estrogen hormone, and estrogen reduction happens as a natural phenomenon of menopause. And because of the reduction in the estrogens, the lining of the vagina, which was supple and more fleshy, will start becoming dry and it starts shrinking. Because of the loss of hormone estrogen, because of reduced quality of the membrane, that is the covering of the vagina, it becomes dry. That is a stage called hormonal deficiency, which gives rise to senile vaginitis. This is called as senile vaginitis. Because of the reduction in the hormone estrogen, the immunity of the vagina also reduces. And because of lack of that lubrication, that is the lubrication is nothing but the vaginal secretion which happens naturally in any intercourse, will be reduced. And because of the reduction in the lubrication, there is dryness of the vagina. So if you want to, in spite of this dryness, if you want to have intercourse, it is better you take the help of some physical lubrication like lubricating jelly, which will not have any chemical. It is just a lubricant gel. So you can use it liberally and you can continue your act. And that is one thing. And one more thing is the immunity of the vagina also reduces, because the vascularity also reduces. When the estrogen level comes down, the vascularity of the vagina also reduces. Because of the reduction in the vascularity, the immunity of the vagina also reduces. So only in menopausal age group, the infections of the vagina becomes more common. So if you have any problem of the vagina like dryness, and if there is any repeated infections, and one of the commonest things that we have seen is repeated urinary infections. This happens very common in the menopausal age group, and this can all be tackled if you meet your gynecologist. She'll take care of it adequately. And it is not that just because you are getting infection, you just be taking on your own. So many patients, they take antibiotics. This is not at all a good thing. Taking antibiotics unnecessarily, it is not at all a good thing. It is not good thing for the society also, because you are creating bacteria resistant infections because of inadvertent use of antibiotics. So if you have this problem of menopause, which gives rise to more amount of urinary infections or vaginal infections, you go to your gynecologist. She'll be able to handle it better, and she'll be able to handle it better in such a way that she'll not give unnecessary medicines, and she'll give medicines that is only needed. Most important message I would like to tell the menopausal age group people, or for that matter any person in society: please don't take antibiotics unnecessarily on your own, because it is not that you are harming yourself, it is that you are harming the whole society, because unnecessary taking of antibiotics will result in bacteria that are all resistant to antibiotics. And nowadays there are too many bacteria which are coming out which are resistant to antibiotics, and so it will become very difficult for the doctors to handle any infections because they are not responding to routine antibiotics. Yeah, vagina depends for its activity on estrogens, because estrogen level will be like a cycle, it will be happening every month. it will produce after menstruation, it will start increasing, and as menstruation comes it will come down. And this is one thing, it is like a manure for the vagina, because the growth of vagina depends on estrogen. So its vascularity depends on estrogen, its blood supply depends on estrogen. So that is the reason the vagina will get very easily affected because of the reduction in the estrogen hormone, which happens during the menopause. Yeah, coming to safest treatment in menopausal age, whether it is hormonal or non-hormonal, most probably it is for the vaginal dryness that happens in the menopausal lady. See, as I told you, menopause is the age when the lady does not have interest in having intercourse, but it is a partner who wants to have it. So sometimes she has to satisfy the partner. So because if she has to overcome this problem of dryness of the vagina, the easiest and the best would be using a lubricating gel. And this is used for youngsters also when they are just married and all. But one more thing is, because of the vaginal dryness, there are so many other things that happens. That is, as I told, the commonest thing that can happen due to reduction in the hormone estrogen is repeated incidence of urinary infection, and this also happens due to the vaginal dryness. So what we can do is, it depends on whether the lady is having diabetes, hypertension, all those things we have to see, and we can use locally effective hormones, that is the creams, vaginal creams which contain estrogens. So if we use those locally useful hormones, it can have immediate relief on the vaginal dryness and all the things that comes out of the vaginal dryness, that is immunity, etc. So what is the advantage of this local hormone is that the amount of hormone exposure for the lady will be reduced and the symptoms will be healed. And so what is the thing is, if there is an increase in, if you want to replace hormones, if you give her hormones systemically, that is orally, if you start giving her estrogen, it will have other side effects. Like example, if you are a diabetic, these are the hormones which are pro-diabetic. So we should not use these hormones in people who are already diabetic. But depends on the amount of suffering that the lady is having. Most easiest method will be giving locally effective estrogen, that is vaginal creams that is containing estrogen. Yeah, definitely. Emotional changes can happen due to this menopausal changes, because she has already reduced her having her hormones which was taking care of her general well-being. And when those hormones have come down, naturally emotionally also she will have problems. And one more thing is, there are so many other things like the bone problems. See, density of the bones will start reducing and they will become more prone to fractures, etc. So these are also things. And sometimes it is not just fractures, sometimes there will be bony aches. Bony aches are known to happen when the hormone deficiency happens. So these are all the things that can increase the emotional problem that a lady faces in this age group.